we observe as educators, as supervisors, that the registrar's wants are often very clinical. They want to know how to diagnose that rash. Why is this thing called a herald patch, and why is it's in a Christmas tree distribution, and why we can just sit tight for 6 or 8 weeks and pityriasis rosea disappears. They want management advice. They want to know how to do GPMPs and mental health care plans. They want to know how to prescribe and order tests and which orthopaedic specialist to refer to, all of which is absolutely valid and important. But in a sense, when we think about what you can offer as supervisors, it would do really well to see the knowledge acquisition as clearly hugely important, but something registrars can do from ETG or MRTA or from other guidelines, and we can help them in some respects. But so much of what our role can be is broader than that, and that's the skills. But just to think beyond the clinical, thinking about those other domains of practice, which are flowing into the needs. So registrars want a whole bunch of stuff, and these needs are the unknown unknowns. They're not aware that they really need to be able to do these things as well, but it's our job, I think, to broaden our teaching, to broaden our supervision and our scope beyond the clinical to think of these other aspects. So clinical reasoning, and when I talk about clinical reasoning, what I usually do to start is to say when I was a medical student, certainly a GP registrar, I don't remember ever hearing this term clinical reasoning as part of my training. And now it's all that registrars talk about because it's the basis of the KFP exam, and it's such a critical skill for registrars to learn and supervisors to support, clearly supporting registrars' communication skills with patients. This incredibly and fundamental approach to managing and looking after patients in Australian general practice around patient-centred care, how to truly see the world through the patient's eyes, how to truly share decisions with your patients, a skill that I would so strongly encourage you guys to foster in your registrars when you're doing all the teaching stuff with them. Professionalism and how we can identify professionalism issues and support professional and ethical practice in our registrars. So again, a registrar often won't see this as a want. They won't want this stuff from us as supervisors and educators, but absolutely most need it to some degree and some need it to a significant degree. Organisational skills, that's a key aspect. The consultation and those core skills as basic as history taking and physical examination and data synthesis and imparting a diagnosis and explanation and safety netting and all those sorts of things. And uncertainty. This is a picture of a swamp, and very often general practice is referred to as the swamp because it's messy and it's hard to navigate compared to the much neater, cleaner environment of the hospital. Reflective practice, how we can encourage our registrars to truly reflect on practice. And I think that's often paid lip service to, but it's an important aspect of what we can do in our supervision role. And it's really just a bit of a sense of these 4 aspects of influence where a practitioner operates. So how they reason, including the clinical and the consultation and the uncertainty stuff, how they form relationships, which is the patient-centered care and the communication, how they reflect, which is to themselves, and how they respond more broadly to the wider world, to the health system, to medical legal side of things. So that's just a way of thinking about that much broader approach to skill development in our registrars than simply the clinical.